Luckily, there is a nice way to determine when you can go to hospital, and it's called the 5-1. Recognizing the signs of labor is crucial for every expectant mother. And in this video, I will walk you through the 5 signs that indicate that labor is imminent and guide you on when you should go to the hospital. Now, first of all, you have to know that it is not always perfectly clear that you are in labor. If you are, for instance, getting a lot of Braxton Hicks contractions, you might think that it's just another episode of Braxton Hicks and not even realize that you are actually having real contractions and end up ignoring it. Some people also have a lower or a higher pain threshold. So where one mom can have many contractions and she doesn't really experience any pain, the next mom will report very painful contractions from the get-go, even though they might be at exactly the same point in their labor journey. So these 5 signs indicate that labor is approaching, but it also doesn't mean that your baby is coming today. It can be days or sometimes weeks before your baby actually arrives. There's only one of these that tells you that you need to go to the hospital as soon as you have the sign. And I'm going to let you know which one it is. So let's start with the obvious one, contractions. So now people are telling you, oh, when you are having contractions, you should time them. Except when you are actually in that position, you don't always know whether you are having contractions, whether it is a bladder infection, whether it is Braxton Hicks. I'm a midwife. I've got many years behind me. And I can tell you, towards the end of my pregnancy, I went into hospital and I said to the doctor, I don't know whether I'm having Braxton Hicks or labor contractions because it all feels the same. And Braxton Hicks is often what people refer to as false labor, but sometimes it can be a lead up to the actual labor. But if you are not sure, I always say just rather go in. The day that I went in with my query, Braxton Hicks or normal contractions, it ended up being Braxton Hicks, and I was 31 weeks at the time. My girls were born just past 33 weeks, so 2 weeks later. That was most probably the start. So once you have the full picture, it might have been Braxton Hicks, but it also might have been a very early indication that labor is on its way. So the difference between Braxton Hicks, regular contraction. Braxton Hicks are not regular contractions, which is why we call the other contractions regular contractions, right? Okay, let's move on from that. Braxton Hicks, they come and go and there's no pattern to it. You can have 2 today, you can have 5 tomorrow, you can have nothing the next day. There's really no pattern. With contractions, they keep coming, and as the name suggests, it is regular. It can be 1 in an hour right in the beginning, or 2 in an hour, and then slowly it is 3 in an hour or 5 in an hour, which is the next point of differentiation between these two. Braxton Hicks contractions don't get stronger or more intense. They stay the same level of intensity. Regular contractions get stronger. The third differentiation, regular contractions come at shorter and shorter intervals. Where they might have been an hour apart or 20 minutes apart, they're becoming shorter. 15 minutes apart, 10 minutes apart, 8 minutes apart. Braxton Hicks doesn't have that kind of pattern. And lastly, with Braxton Hicks, if you should change your position, or you go for a shower, or you go for a walk, they might go away and then you don't experience them anymore. Normal contractions, they won't go away regardless of what you are doing, they will stay. Okay, moving on to the second one, a show or your mucus plug. Now, the mucus plug sits in the cervix to protect the baby when you are pregnant. When the cervix starts to dilate, obviously now if you look at my hand like this, if this opening opens up and there's a piece of mucus right here, there's nothing to hold on to anymore, so it comes out. I actually have a video right here about how a cervix dilates in labor and why it takes so long for you to become fully dilated. So now, if your mucus plug comes out, the reason it comes out is because something is happening with your cervix. It's starting to soften, it's starting to dilate, and that can be the very early start of labor, but it can be weeks before you actually go into labor. So just because you see the show doesn't mean your baby is coming right now. It just means your cervix is going through changes in preparation for labor. Now, the only thing to note here is that if you are more than 37 weeks pregnant, you don't have to do much if you see this show comes out. It looks very slimy and it can have a little bit of blood in it, like it can be a little bit pinkish or blood tinged. If you are less than 37 weeks, so still premature, it is advisable to contact your healthcare provider. They might advise you to go in for a checkup, because if you are preterm and you are going into labor, which is why you lost the plug, they would want to take the necessary precautions to make sure that you don't go into full-blown labor, or they can stop contractions if you might already have them. Number 3, having lower backache or lower abdominal pain. Now, you might be experiencing backache through the entire pregnancy, so it's sometimes difficult to know. But the lower abdominal pain is one that is more significant when you are in labor. But there's a catch. There's always a catch. Because if you have a bladder infection, you can also have lower abdominal pain. In fact, the most common cause of mothers coming into maternity wards thinking that they are in labor is because of bladder infections, because it has a lot of similarities, although there are differences. So if you have a bladder infection, your bladder is sensitive, it's sore, and it causes this dull aching in your lower abdomen, just above the symphysis pubis. The difference here compared to contractions is that if you are having contractions, it will be more like a crampy feeling that comes and goes. When it's a bladder infection, it doesn't come and go. It's a persistent sore ache, like in your back. It just stays sore. It doesn't come and go. Another way to tell the difference is if you are having contractions, whether it is regular or Braxton Hicks, your stomach will tighten up from the contraction. If it's a bladder infection, it won't. Note here that a bladder infection that is untreated can irritate the uterus and actually lead to labor. So it's always important to get right on top of it if you think you might be having a bladder infection. If you don't know, like I said, go and check it out. But early labor can cause a lot of lower backache as the baby is moving down into the pelvis and wiggling. You can feel a lot of pressure here and in your lower abdomen. Also, as the baby is moving and descending into the birth canal and the contraction, giving you this lower abdominal feeling. That on its own doesn't necessarily mean you are in labor, but it's a sign that it might be. And at any point in time, if you start having multiple of these signs, then it would give you a pretty good indication that you are in labor. Now, the fourth one is when your water breaks. And this is the obvious one. If your water breaks, you kind of have to go into the hospital. It can be a big gush or it can be a trickle. So even if your water breaks, you also don't always know if it actually happened.
Okay, let's go! Yeah, Atlantic City! Woo! Come on!
Woo! Atlantic City, baby!
Oh!
Ow!
Oh! Phoebes, you leaking.
If you are not sure how you will know, I've got a video here where I take you through how to determine whether your water is actually broken or not. This is the one sure sign. If you have a gush of water, you know it is your water that's broken. You know that you are going into labor and you have to go to the hospital. You can have your water broken without having a single contraction. And they might also not start. The thing with your waters breaking is that now there's an opening between the baby and the outside world, and it's a moist, warm environment where bacteria like to grow, and now there's an entry point. So there is a time limit on how long you can labor for or walk around with your waters having broken before the risk of infection becomes a concern. That's why it's better to go in, note the time when your water breaks, note the color, and note if there is any specific or offensive smell to it. And that's the information that you will give when you go to the hospital and you get admitted. Now, when do you go into hospital? So I mentioned now if your water breaks, you go in, obviously. When you are having contractions, do you go in at the first contraction? You rush into hospital? Do you wait? Like, when do you go? Luckily, there is a nice way to determine when you can go to hospital, and it's called the 5-1-1 rule. Very easy to remember. 5-1-1 rule. What does it refer to? So if you are having 5 contractions, each contraction lasting at least 1 minute, and you've been having these contractions for at least 1 hour, it's a good indication that you can go to hospital. So if you want to look at it from another way, in an hour's time, that would be at least 12 contractions, and every contraction being at least 60 seconds. Just a note here that more than 5 contractions in the span of 10 minutes is called hyperstimulation. There are certain risks associated with it. So if you are counting and you realize that you are having more than 5 contractions within 10 minutes, it's better to call your healthcare provider and get to the hospital that they can see what is the cause of this and if they can slow it down a little bit before it becomes a problem for you or your baby. Okay, so the last sign. If you have this sign, you should panic a little bit because you might not have a lot of time. But sometimes people have contractions that are not painful, like I mentioned in the beginning. Their waters didn't break and the show didn't come out. It is very possible that you never actually see the show, that it only comes when the baby is born. There's no guarantee that you will see the show coming out. So sometimes people labor and they don't realize it, and suddenly they might start having a very persistent urge that they want to go to the toilet for number 2. It just keeps coming the whole time. Now, you might be constipated and having the same feeling, but if you are having any sort of contraction, tightening of your stomach the entire time, and then you start having this urge that you really need to bear down, there's a possibility that you might be one of those moms who labor silently, and the baby might be pressing down, and the moment your water breaks or you actually sit on a toilet where you open the pelvis, that baby wants to come out. Now, I don't want you to panic too much here because that is not very common. Again, if you are unsure about anything, always call your healthcare provider, call the ward and tell them what your situation is, and they will advise you according to their knowledge or their protocols what you need to do. But now, speaking of your water breaking, what if your water breaks too early? What are you supposed to do? I've got a video right here to tell you exactly what you need to know if your water should break prematurely.